One of the common causes of abnormal vaginal bleeding are uterine fibroids. Fibroids are very common and found in about 25% of normal women. So if you took 100 women off the street that had no problem at all and you did ultrasounds, about 25% of them would have fibroids. However, in some women, the fibroids can cause quite a lot of problems, and bleeding being one of the most common ones. Now, what are fibroids? Fibroids are basically muscle tissue that's grown in a hard ball. And so basically the uterus is made out of smooth muscle cells, but those smooth muscle cells are organized into the uterus in a way so that when the uterus contracts, these muscle cells work in concert to get a nice normal contraction of the uterus. With a fibroid, those same muscle cells, instead of growing in this organized fashion, grow into these spindly balls of hard tissue. And so when the uterus goes to contract, these fibroids aren't able to contract in concert with the rest of the uterus. And so they really just get in the way of the uterus. And so fibroids really are normal tissue growing in an abnormal way. Fibroids don't turn into cancer. They're not dangerous in and of themselves, but because they don't function in the proper way, they can cause problems such as bleeding or pain. Now, bleeding can be caused by fibroids for a couple of reasons. One is if the fibroid grows in the inner part of the uterus or impinging on the endometrial cavity, the inner part of the uterus. Now, the endometrial cavity is the area that gets sloughed off every month when menstruation happens. If the fibroid gets in the way of that, you may not get that nice organized sloughing, and it can cause increased bleeding or prolonged bleeding, or sometimes even frequent bleeding. So that's one way that fibroids cause bleeding. Another is that if there's enough fibroids or there's enough bulk of fibroids that it gets in the way and interrupts the contraction of the uterus overall, it can keep the uterus from contracting, which helps it to stop bleeding. And therefore the bleeding will continue longer and heavier than it should. So those are ways that fibroids cause bleeding. Now, fibroids can also cause pelvic pain. One way is by interrupting the contraction of the uterus. The uterus has to contract harder to function in the same way, and that can cause a lot of cramping. Fibroids can also grow outside of the uterus and impinge on other structures within the pelvis or abdominal cavity and can push on things, and that can cause pain as well. Occasionally, fibroids will get so large that will actually distend the abdomen, and so we'll see sometimes women that look like they're 6, 8, 9 months pregnant because their uterus is just filled with fibroids. So instead of having a baby, a fibroid is taking up the same type of space that a baby would normally take up. Now that, of course, can be very uncomfortable. Just like when you're pregnant and you have a large uterus, that can be uncomfortable as well. So that's another way that fibroids can cause pain. Sometimes fibroids will grow rapidly and they'll outgrow their blood supply. When that happens, the fibroid will what's called degenerate, or basically die, and start shrinking. Dying tissue can be very painful, and that can also cause a lot of pain. So those are ways in which fibroids can cause pain. Now, fibroids can be found in various places within the uterus. They can be found in the inner endometrial part, they can be found in the body of the uterus, or sometimes fibroids can be what we call pedunculated, which means that it's basically a big fibroid hanging off a little stalk that's attached to the uterus. We also sometimes find fibroids in the cervix, or we can find them in the ligaments that attach the uterus to the abdominal wall. The other thing that we find is that women that make fibroids tend to be fibroid makers. So even if we do something to remove the fibroids that are present, those fibroids tend to grow back over time. Now, there are lots of ways to treat fibroids. There are medicines that can be used that can either shrink the fibroids, or other medicines that can control the symptoms of the fibroids, such as the bleeding or the pain. There's also surgical techniques that can remove fibroids. There's a surgical technique that can decrease the blood flow to the fibroid and cause it to shrink. There's the ability to remove the fibroid from the uterus, or sometimes we do what's called a hysterectomy, where we remove the entire uterus and take the fibroids out with the uterus. So there are many ways to treat fibroids, and the ways that your fibroids need to be treated really depend on your individual circumstance and your symptoms.
Medtwice.com